So, why have peanuts been perceived as such a risk? Well, I think there are four key aspects to this. And the first is that peanut allergy is legitimized food allergy. In peanut allergy, both allergists and the allergic can demonstrate the danger presented by certain foods. Unlike other foodborne risks to health, for example, pesticides, food additives, or even foods with excessive fat, sugar, or salt, the risks posed by peanuts are clear and immediate, at least to those who are allergic. Also, in peanut allergy, we have a large number of stories of bizarre reactions, which I'll talk about a little bit later. And I think that taps into the media hunger for such stories and discussing reactions to things like peanut allergy. Another element is that this is very much a grassroots, patient-led, but also industry and medical association assisted movement. And in fact, a lot of the independent initiatives far outweigh the restrictions put in by regulators. And in this way, and this is the final point, that certain food manufacturers can use peanut allergy as, in some ways, a marketing ploy. So what's the actual risk? Well, this is somewhat difficult to be 100% certain about, but peanuts are responsible, it's believed, for about 150 to 200 fatal reactions in North America and about a dozen or so fatal reactions in Britain. 30,000 Americans require A&E care every year because of reactions to potent allergens such as peanuts. And anaphylactic shock, the most severe of the reactions that you can experience to peanuts if you're allergic, can be a fatal reaction where your airways obstructed and you suffer precipitous drops in blood pressure. Now, despite the fact we're having up to 200 fatalities a year in North America, prior to 1990, and that this is actually a 1982 quote, but I think it's quite alarming actually when you think about it, peanut allergy really wasn't considered all that much at all. Here it says, peanuts are potent antigens. Just how potent has never been fully explored. There's no documentation of fatal or near fatal anaphylaxis reactions in the medical literature, although explosive allergic reactions to the ingestion of botanically related chickpea and pinto bean have been described. Now, I haven't come across too many fatal reactions in the medical literature, but certainly in the media there are at least 2 or 3 cases where there were fatalities in the 1970s. One little boy had some Butterfinger ice cream, peanut butter in there. He died after that, and a college student died after peanut butter was used to thicken chili. And I think there's that aspect of it. We think of George Washington Carver, who came up with 200 different uses for the peanut. This is one of the aspects that plays into the whole narrative, is that this is a very useful food product in many ways. So, if peanut allergy wasn't really that important back prior to 1990, what was? What the focus was on prior to the emergence of peanut allergy were more chronic reactions to food allergens. And food allergy itself was seen as a much more controversial and disreputable concept. It was called witchcraft, a fad, or a racket. And as a pair of allergists described in the 1950s, controversy rages around the clinical importance and frequency of food allergy in a more lively manner than around any other subject in the field of allergy. And there were a number of reasons for this. First, the food allergies that early food allergists focused on up until the 1990s were, as I said, chronic food allergies. They're very difficult to diagnose and treat. Unlike most allergies, skin testing for food allergies and desensitization treatment was believed to be ineffective at best and quite dangerous at worst. Although this is changing, there are trials going on at Cambridge to try to develop desensitization for peanut allergy. Certainly not back then. Food allergists instead used diet diaries and elimination diets to determine which foods were at fault. And this meant largely relying on patient testimony and clinical observations rather than laboratory tests and biomedical solutions. Second, because of these difficulties, food allergists such as Albert Rowe, Warren Vaughan, Arthur Coca, and Theron Randolph claimed that an astonishingly wide range of symptoms, ranging from migraine and hyperactivity to asthma and eczema, were caused by food allergies. The chapter of one of Arthur Coca's books was "You Don't Catch Your Colds, You Eat Them," for example. Now, before you discount Coca as a complete quack, it's important to note that he founded the Journal of Immunology, edited it for 3 decades, was president to the precursor of the American Academy of Allergy, and worked for Letterly Laboratories for many decades. So these are interesting characters, some of them. Now, orthodox allergists, and this is important too, they suffered very much similarly to psychiatrists in terms of trying to make their discipline legitimate in the broader medical context. They believe that these sorts of theories threatened the validity of allergy as a concept and downplayed the importance and extent of food allergy. With peanut allergy, this was very different. Unlike many other reactions to food, which are often dismissed as mere food intolerance and not true food allergy, peanut allergy sufferers reacted immediately. There are no questions about what caused it or concerns that what the reaction was, or if it was psychosomatic, which is another interesting aspect of food allergy. The reaction was also accompanied by the immunoglobulin IgE, an antibody discovered in 1967 and believed to be the telltale of a true allergic reaction. So with peanut allergy, allergists had an example of food allergy that was unquestionable, deadly, serious, and fitted into acceptable immunological theory. So that's the one aspect. The second aspect I think it's important to emphasize is that many of these reactions they're strange, they're unusual, they're bizarre, they capture the headlines. And these are just 2 examples in Quebec that came out at roughly the same time in around 2005. First case was a 15-year-old girl who died after it was thought kissing her boyfriend who had eaten a peanut butter sandwich. Now, while the coroner was unable to prove that this was actually the case, it really, as you might expect, the fatal kiss in the headline really captured the attention of the media. The other case is potentially even more bizarre, and this is a case of an 80-year-old woman who developed a peanut allergy after a blood transfusion following an operation. She had eaten some muffins in the hospital that had peanuts in them, and the issue that this raised amongst physicians was should donors also be screened for food allergies and other types of allergies. So this fits into what Clive Seal has described as the depiction of ordinary objects whose ingestion is essential for life, yet nevertheless reveal themselves as threats to life, presents a highly entertaining juxtaposition of opposites for the media health producer. And one result of this is Sabrina's Law, which was passed in Ontario in May 2005. And this is an interesting one because it's kind of the combination of a bizarre reaction and a lot of grassroots lobbying to get legislation passed. And the law that was passed was actually a private member's bill, which is in the Canadian parliamentary context are very, very rarely passed.